The World Health Organization estimates that each year, over 40 million people die from non-communicable diseases, with the majority of deaths occurring in low and middle-income countries. In Kenya, experts have observed that NCDs account for over 55% of hospital deaths, while more than 50% of all hospital admissions were due to NCDs. In a bid to reduce the burden of the disease by the year 2030, the government has been called upon to incorporate more community screening programs, a move which will reduce the mortality rate of the disease in the country.
Most of these diseases are not diagnosed in the early stages. So we need to have clear programs where maybe even we have the CHPs empowered, and even more medical care providers do constant screening in the communities, because you see our intervention is more on sensitization, but as a group we don't have the technical know-how on the screening. But once we do early screening and early diagnosis, then we can be able to reduce mortality as a result of NCDs.
This was the call to action during a caucus in Naivasha, bringing together health experts and community-led organizations. It was observed that there was still insufficient funding by the government to counties towards preventing, screening and treating the disease.
We have like the screening machine for cancer within the county referral in the county, but then we lack expertise. We don't have proper human resource. We don't have the doctors, we don't have the technicians to even run the machines. So you realize that some of the services we benefit from other neighboring counties. So I think there is need for more investment, even in terms of infrastructure and even in terms of human expertise, so that screening itself and even treatment can be done within the county referral hospital.
Availability of medicine in the country fell below the WHO recommended 80%, with only 8 counties reporting availability of NCD medicines.
Other NGOs, their commodities are designed for specific populations. So even if they are giving out the commodities, they are not giving out enough because they are limited. Their commodities are designed for specific needs to their beneficiaries.
Medicine stockouts in the public sector was further identified as a challenge. According to experts, the Kenya Medical Supplies Authority (KEMSA) typically fulfills 70% of the orders requested by counties.
Major point of intervention is to even have this question being part of the upcoming census in 2029, so that you can have a question like how many do we have an NCD patient within the family. So maybe so that once we have data, that can advise how much can be allocated towards screening, preventing and treating the disease.
Stakeholders noted that the NCD burden threatens the country's quest to advance the universal health coverage agenda, a central pillar to the health reforms agenda that includes prevention and care for NCDs. Gertrude Burgay, K24 TV.